We all hear that Taiwan's national health insurance is world class. But what's the secret sauce? What really makes it work so well? Well, a huge part of it is the rules, this invisible framework that keeps the entire massive system fair and stable for everyone. Today, we're going to pull back the curtain and take a look at that very framework. So instead of thinking of the NHI as just some government program, I want you to picture something else. Imagine it's a living ecosystem, like a huge, sprawling forest. It's there to provide shelter and care for all of us, making sure that if we get sick, there's a safety net ready to catch us. And just like any healthy forest, this ecosystem needs some ground rules to survive and thrive. Rules that keep everything balanced, fair, and sustainable for years and years to come. So today, we're diving deep into that rulebook, specifically chapters 7 through 11 of the National Health Insurance Act. Here's the game plan. We'll kick things off with the rules for our healthcare providers. I like to call them the caretakers of the ecosystem. Then we'll get into the financial safety nets, what happens when people break the rules, how the NHI plays with other insurance plans, and finally, we'll wrap it all up by talking about why this stuff matters so much. All right, first up, the hospitals, the clinics, the pharmacies. In our little forest analogy, these are the dedicated gardeners and caretakers. And believe me, they have a really important set of responsibilities to make sure every single one of us gets the care we need. So how does a hospital or a clinic even become part of this system? Well, Article 66 makes it pretty straightforward. First, they apply. Then, the NHI administration checks out their qualifications. And if they make the cut, a contract is signed. It's that simple. It becomes a formal partnership to serve the public. Okay, now this is a really crucial rule. Article 67 makes it crystal clear that contracted hospitals can't just have a few beds here and there for NHI patients. No way. They have to dedicate at least 60% of their total beds as insurance beds. This isn't just some random number, it's a promise. It guarantees that the system is focused on public health for everyone, not just on fancy private rooms. Oh, this is a big one. Article 68 is all about fair billing. See, hospitals can charge the official, legally defined copayments. That's fine. What they absolutely cannot do is just invent their own extra fees for services that the NHI already covers. This is huge because it protects all of us from those nasty surprise bills and keeps pricing transparent. And the list of responsibilities keeps going. Providers have a whole set of core duties. They've got to check your NHI card. They can't just turn you away because you're using NHI. They have to give you a copy of your prescription. Plus, they need to be totally transparent, reporting on their finances and quality of care, and even figure out ways to reduce medical waste. It's the whole package for being a good caretaker in the system. Okay, so we've seen the rules for the caretakers. Now let's look at how this whole ecosystem protects itself. Every system has to be able to weather a storm, right? For the NHI, those storms are usually financial. And there are some really powerful safety nets built in, both for the whole system and for you and me if we're struggling. The biggest safety net of them all is the NHI Safety Reserve. Think of it like a giant reservoir for our healthcare forest. Article 76 says this fund is legally required to be there, ready to cover costs if there is some kind of unexpected financial drought. It's designed to make sure the system never, ever runs dry. So where does the water for this reservoir come from? Article 76 lays it all out. It's filled up by any surplus money at the end of the year, penalties from late payments, income from smart investments, and even a slice of the levies on tobacco and alcohol. It's a bunch of different streams all flowing into one place to keep it full. But what about a personal financial storm? Let's get real. What happens if you, an individual, are having a tough time and can't pay your monthly premiums? Does the system just kick you out? The answer is a big, resounding no. Article 99 sets up a special relief fund just for this situation. If you're facing economic hardship, you can get help. That could mean an interest-free loan to cover your premiums, a direct subsidy, or even setting up an installment plan so you can catch up over time. See, the system is designed to help you, not to punish you. Next up, let's talk about the referees. To keep any ecosystem healthy, you need rules, and you need consequences for breaking them. This part is all about how the NHI makes sure everyone, from you and me to the giant hospitals, plays by the rules. So, the NHII doesn't just sit back and hope for the best. Nope. Articles 79 and 80 give its administration some serious power to investigate. They can pull data from other government agencies and directly audit anyone in the system, employers, hospitals, you name it, just to make sure everything's on the up and up. And if they find someone breaking the rules, well,
Chapter 10 is basically the system's penalty box, and it does not mess around. As you can see, the consequences are specific and pretty severe. An employer who doesn't enroll an employee? Big fine. A hospital that commits fraud? They could be fined up to 20 times the illegal amount and even get kicked out of the program. And get this, the rules are even updated for the digital age, with serious penalties, including prison time for cyber attacks on the NHIS systems.
All right, let's tackle a question that can get a little confusing. What happens when you have an accident that's also covered by another kind of mandatory insurance, like workers' comp or car insurance? Who pays the doctor?
The law actually makes this super clear to avoid any headaches. For a workplace injury, Article 94 says the occupational hazard insurance pays first. Simple enough. But for a car accident, it's a different story. Article 95 says the NHI steps in and pays for your medical care right away, so your treatment is never delayed. Then, behind the scenes, the NHI gets that money back from the car insurance company. It's a smart system designed to put your health first, always.
So, we've walked through the rules for providers, the safety nets, the penalties, the whole shebang. But let's zoom out. Why does this whole complicated web of regulations matter so much? What's the big picture here? It really comes down to this. These laws aren't just a bunch of red tape. They are the invisible structure, the roots and the trunk of our healthcare forest. They're what makes sure hospitals are accountable, that the money's stable, that fraud is punished, and that every single person, no matter their situation, has a path to get the care they need. This framework is what makes the system truly work for all of us. And that brings me to one last question for you to think about. As medicine gets more and more advanced and costs keep rising, the pressure on this ecosystem is only going to increase. So when you look at all these rules we've talked about, from the financial reserves to the duties of our hospitals, which ones do you think will be the most critical for keeping our health system strong and fair for whatever comes next?